and welcome back to the Care to Talk podcast. I'm Alina from the NUHS Wellbeing office, and I'm really glad to have you with us here today. So today's episode is all about balancing the middle ground. And this actually encompasses a lot of people. The middle ground are the people who bridge strategy from the senior leadership and execute that all out on the front line. And this, as you can imagine, has significant responsibility because these are the people who are responsible for staff performance, for productivity, and they have to be really agile and evolve to the changing situation on the ground. All this while they have to build their own careers and their families. So I'm really honored to have two guests to join us today. We have Daphne Chan from Alexandra Hospital and Jacinta Soh from NUH.
Hi everyone, I'm Jacinta from NUH, currently with Department of Surgery and Urology. I'm a senior manager overseeing the outpatient clinics portfolio. So my role essentially, if we put it simple in layman form, firefighting to a certain extent at back end for the benefit of our patients as well as our own staff.
Hi everyone, I'm Daphne. I am currently a pharmacist in Alexandra Hospital. I have been with AH since we started in 2018, but prior to that, I was with NUH. So currently, I lead the inpatient pharmacy team. So I'm the overall pharmacist in charge for inpatient side. On top of that, I still cover wards. I see patients, so I see ICU patients. And I also set up the antimicrobial stewardship program for AH. So amongst the other hats that I do.
Thank you so much. I think that gave us an idea of what your work life is. It's a lot of different moving parts, and both of you have to do leadership as well as do groundwork. So as we said earlier, the middle managers are people who take directives from the top and operationalize them. And maybe we can describe them as the connective tissue of healthcare. Bear with me. Crucial, but under-recognized until injured or not functioning well.
From my point of view was, you see the messages, that senior leadership wants to do. You see the direction that they are going to have, right? And senior leadership is very clear in terms of the goal, the mission, whether it's 3 years, 5 years, or whatever else it is. And you see that, right? Because you are privileged to be with them as they discuss work plans and so on and so forth. But I see myself as an injured connective tissue in some ways, but healing nonetheless, right? Because it's empowering to be able to take that message, right? Mm-hmm. Translate it in terms of something that is practical for the team, right? So it's a big chunk of information and dreams and goals. And the main thing that usually the team asks you is, Daph, what do I do? Right? It's a really grand plan, yes. Right? Then the next question you always get asked is, but I've got to see my patients, I need to see patients. I need to, my patients are going to be, my priority, right? So then how do we gel? How do we gel that whole story together? And frankly, I might not be able to gel all the time. So that's where I see it being unique. Because you kind of like,
Yeah, so you're taking something very abstract,
right,
and having to translate that into reality.
That's right.
Yeah,
that's right.
Jacinta, what about you?
Yeah, so for myself, so as opposed to what Daphne feels, she is somewhat injured. I think for myself, I see it at 2 points of view. One, I do see myself as a bridge between, even from my boss to my direct reports, in a way whereby, alike to Daphne, right? We have to absorb whatever information that's given to us, big info, big pieces, and we kind of have to dissect it and fit it into bite size, because it's not something that our direct reports or the juniors could at one glance kind of say, oh, because of this, right, I know exactly what I'm going to do. And there's some form of instructions to be given, and same thing, what's next for them. But at the same time, I do see myself as what I call safety net for my own direct reports or my juniors, because when when they have something that they need to clarify, you are the first person that they go to, and you know that kind of indirectly tells you that they're very comfortable with you. They know exactly they can rely on you, and to a certain extent that forms as a bridge of even feedback between both sides of the party, and it does help in aiding the conversation going without having everybody side guessing, like what's the boss intention, what's the boss direction, and likewise for the boss, what is the team's direction going ahead with this. So I do see ourselves as very vital positions,
definitely.
although sometimes even I myself, truth to be told, is confused with certain things. But yes, we do seek clarifications along the way, and yes, communication does help. And so that's how I see myself being in the position as a bridge.
So I was wondering, what the advantage of where you are now is compared to the senior leadership that lays these visions and directions. And I'm hearing that it's got to do with a lot of knowing what's actually happening on the ground, the nitty-gritty details, and also being accessible to the teams, that they can directly approach you perhaps more easily than they can go up to the senior leadership.
Personally, for me, I felt that in the current position, I am, I guess, outspoken to kind of tell boss and others,
I feel you.
hey boss, I don't think it's going to work.
Yes.
In probably less polite, more polite words, depending on the situation, right? So we're going, I think this is completely really doable. I think it's great. The team's going to feel uncomfortable, but so what? We will have to cross that bridge as it comes along, because it's going to be a really good change. Some things going, maybe we can parking lot this. Indirectly going, boss, can we not do this? Because let's do something else. Whereas if we were to go, your team to tell you, but that is not going to work. Yeah. But you see them, you see that if they were to take that one tiny step, then the next tiny step, the next tiny step, and before you know it, right, they're like, they're just rolling along the way. But it's just usually that first step that they go.
It's usually a first step that's difficult.
Correct, right? Correct. But a lot of times where the team goes, yeah, I'll do it. I'll do it. Because we're a team. Let's do it. But if the messages, like you say, if the message is not very clear, or they don't see yet that direction, so that's where you really spend the time and the effort painting that picture and that
picture,
book.
or even asking them to do that one step out.
Yeah,
because it's that step that you need to kind of convince them that never try, never know, right?
Correct.
Let's just move ahead. Go in with an open mindset. I mean, having to try better than not to try is to tell you that, hey, at least I've tried, that boss, it doesn't work, or hey, maybe there's something else that we can tweak to the workflow to make it even better.
Correct.
But both of you have a knowledge, an intimate knowledge of what is happening in order to know how to break it down to take that step. And I think that is really the gold, right? Because you understand the vision, you understand the difficulties, the challenges that you need to push, but you also know when to say, okay, this is ready, we can push, or when we can hold back. Yeah. So I think that's really the treasure that you are. Senior leadership, if you're listening, I hope you're valuing all this. Okay, so let's talk about some personal challenges. Sure. And I'm sure there are. Well, all in healthcare, we know that healthcare doesn't stop. Never. Right? Work-life boundaries sound great, but if you work in healthcare and something like COVID hits or a mass casualty incident, it's all hands on deck. You drop everything and run. And in fact, it's our privilege to be able to come. But these demands do really spill into our personal lives. How do both of you practice self-care? Do you practice self-care?
Thank God. The man I married is so supportive. 100%.
Oh, shout
well
out
done
to Mr. Daphne.
Kudos. Well done. Well done to me. I chose the right one. Healthcare is really a calling. Whether it's ops or whether it's direct care or indirect care, it's really, you have to have that calling, the I love my job really lasts a certain period of time. Thereafter that slow fire just keeps on having to burn. So the family is so supportive, okay? Friends are supportive. But I think other than them, personal life being supportive, right? Your colleagues' support, your teammate support is really, really so ultimate. So before I came for the podcast today, so I went to ask around, what do you treasure the most, right? Some will say, work, patience, what I do is really very valuable. But amongst it all, right, they always say teammates, seniors, colleagues, peers, and that really drives. I mean, work can be harsh, right? And it's painful, not painful from the workload, but painful from loss of patience, loss of colleagues and cared ones, frustrations. Yes. But when you have that team, that really team along the way, that those are the connective tissues, right? And to me, that was my source of support, other than family and friends.
So for me, very much similar to you. I
Good
have
husband.
maybe not so good husband as you, but I have very supportive villagers. So both sides, my in-laws and my own families, they are the ones who will stretch their hand up and say, hey, me, I'll be here to be ready to take care of a kid if you, be it whether it's work or personal. I do practice me time, self-care. So there is always time for a massage. There's always time for facials. As in, this is something that I never knew that I needed it. Not until I think I became a mom, and time became so precious that you're like, hey, I have 24 hours a day. Where did that 24 hours go? That I couldn't even craft out that 1 hour for a self-care kind of thing. So I deliberately do it. And in the event, if let's just say my husband is also away for work, that's where I activate my villagers and say, hey, somebody adopt the kid. Adopt the kid, give me my 1 hour me time.
Definitely lean on people, right? Like
Yes.
whoever they are, just lean onto any and everyone.
Correct.
That's willing to be leaned on.
Yes. And I totally appreciate.
Don't be choosy, right?
Yes.
Don't be choosy.
Whoever wants to.
Yes, definitely.
And I'm also with you in a sense of when I'm on leave, my covering partner, perfect. I can always leave it in her hands and even my boss too, to cover things when I'm away on leave. So much so that in my years here, right, I've never gotten a call when I'm on leave.
Wow.
Says quite a bit, isn't it?
A lot. That's a lot.
That is true.
Yes.
And the fact is that I'll come back to understand that, hey, I've kind of cleared this, but there's still like this and this for you because not very urgent. Now I'm like, it's fine. It's totally fine. I understand that, you have families at home that kind of need to support you on it, but equally important at work that you need to have a supporting system or supporting team with you to help you to kind of bring you through your days in the office because literally being at work, second home.
Yes.
So our Chief Wellbeing Officer, Professor Daniel Goh, loves to say self-care is not selfish. And it's really so true, especially as mothers. I have 3 children as well. It's so easy to lose yourself, right? Between work and kids, what time do you have left?
Yes.
And it's actually a discipline to carve that out, understanding that there is benefit, there is payback for that time invested. But I also bring this up because we know that manager or RO well-being very strongly correlates with the well-being and staff retention and also work outcomes. So we see this in the literature. Can you think of any moments in your work life when your mood, your frame of mind have really influenced your team or their performance?
Okay, so my team would have known me as a very calm person, even in very rushed scenarios and situations. So in very rare occasions where I kind of raised my voice a little, I think they will kind of sense that, hey, today's Jack's mood is not exactly in a good picture. But the fact is that what I do is that I do recognize that it does affect how they move certain pieces or certain work for that day, their schedule. And the fact is that they will not disturb me for a while, but when time comes, they will still have to come to me and say, sorry, I know today may not be a very good day, but is it okay if I, can I have a discussion with you on a certain piece of work? And I think for me, I appreciate that they have given me space to kind of like maybe thought through, reflect, cool down and stuff. But for myself, over the years, I mean, as manager, I learned that, our mood generally may or may not affect everybody within the team. But we kind of practice that reminder to self that whenever something gets into the head and stuff, you kind of remind yourself that in a position I'll still have to kind of keep calm, do certain things that I kind of supposed to do because people are looking at you, people look upon you, and what you do is that while being managers, we're also role models. So how we project ourselves and the image that we portray in the eyes of our juniors and even to our bosses does have somewhat an impact to how people react and how work is kind of done along the way.
So you know them well enough to sense that change in that dynamic.
Yeah.
And you also know what the consequences might be. So you've become more aware of that.
Yes.
Even though it's quite subtle.
Yes.
It's nothing to blow up.
Yeah.
You do see that influence, yeah.
Correct.
Maybe in the clinical setting, things get a little bit more heated, Daphne. Yeah.
I was just about to say I'm a complete opposite of what this very calm and collected lady is next to me about. I'm the opposite. So by nature, I'm more dramatic. I am definitely a lot more outspoken. On normal days, the office is a little bit noisier. The noise is generated, the patient load and whatever not, right? Then you're discussing about, what should I do? What should I not do? And things like that, right? So conversations just get thrown around, right? And it's something with the noise and the distraction, I truly treasure that. I really, really treasure that. Like, you have that comfort level, where you're in your own safe space and they are in, I hope it's their safe space, right? To be able to just open up, throw whatever that's required, right? Without that reserve, without that, okay, should I think about whether I want to say this? Or will I offend anybody if I say this or I do this, right? But yes, I've been taught that how I react, how my body language, my facial expressions are more important actually than the words that I'll be saying. A bad day for me is when I'm very more quiet. So that's where they'll go, like the temperature has kind of dropped, like frigid, frozen. But so that's where I think they will come go, hey Daph, is it a good time? Now I'm like, yes, it's going to be a good time. Or if it's really, really not a good time, right? Because I need to be in the right headspace, right? To be able to do right by my teammate or my peers, right? If at that 5 minutes, I'm not in the right headspace, I go, I tell you what, give me 10 minutes or give me X number of minutes, right? And I'll come back to you, then let's discuss about that. So then in that 10 minutes, then really it's the, let's calm down, breathe in, breathe out, go for a walk, eat a half a packet of chips, like whatever comes. And then when the mind is clear, then it's really that the flow comes, then whoever it is, at least doesn't feel like she's gonna blow. Or it's
that sensing, right?
Right, that dung 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 coming on to
What is so interesting to me listening to this is that both of you work in actually very different kind of environments. But the similarity is that you want your teams to be able to come and talk to you.
Oh, definitely.
So you are very conscious about how your mood is affecting them, and you know when they step back a little bit. That noticing that mindfulness is actually really important to the work that you do, to the teamwork.
My team has been really forgiving towards me of all the countless times that I've screwed up, done the wrong thing, or said the right thing at the wrong time, or the wrong thing at the wrong time.
But you're only human, so it's normal.
I think maybe it's a mutual respect thing.
Definitely.
It's a give and take.
So for them to forgive and forget all the things, I truly say that, it was really tolerant of them and I really appreciate that.
I think what's also coming across is that you're very authentic. to your teams. And I'm sure that they feel that as well. And that really makes you a much more approachable boss in that sense, because there isn't that kind of divide. You've described so many multiple roles that each of you do, right? And we really only scratch the surface. Bridging those kind of multiple responsibilities must be challenging. Maybe Daphne, because you have to see patients, you have clinical responsibilities as well as administrative ones. And I think that I imagine will be very challenging. I'm also a clinician, so sometimes the things that come down seem at complete odds with the work that we need to do, and in your head as you're listening, you're like, how is this going to work? Yeah, maybe you can tell us a little bit about that.
I think it's a facade sometimes. That if ever I give anyone the impression that I'm handling it well, it's a complete facade. It's a lie, and I'm a liar. I have to say, no, okay. In all honesty, remember Tak Ting? He told me there are 3 things in this world. If it's urgent and critical, that goes first.
Okay.
If it's urgent, not so critical, it goes second. If it's not so urgent, not so important, then we put on a 3rd thing. So a lot of my bucket of things go into number 3.
Yeah.
Right?
Not urgent, not important.
Not urgent.
Sorry, not so urgent.
Not so urgent.
important.
So then you get calls going, hey, Daph, about this thing and this thing. You're like, oh. Like, can I get back to you? So,
Yes.
initially, I thought to be a good teammate, to be a good leader, I needed to take and carry everything, and then move on. The typical innocent, naive person that I was. So I needed then to really change my mindset. My goal, and remains my goal, was that I'm going to want the best, independent, super reliable and high-performing team. Right? But for me to do that, I needed to cut the pie, right, and shove a lot of pieces down. Like really keep on shoving down, so that they can take and go and run, right? So that was again a very conscious thing that was taught to me. That was taught to me and say, you Superwoman, Iron Man meets Avengers, right? You're not one. You want your team. So you want your team of Avengers. You need to train your Avengers. Get them to be, because they really are.
Yeah.
So that was when I really very, very consciously started moving things to them, so that I can bring them along with me in the various journeys that I have to go through. Eventually, when they come to be where we are, I want to be able to show that it's nothing wrong at all. In fact, it's what you need to do. Like lean on your village, right?
Yes.
So that's where I started carving out the pie, and making sure that this is your very large piece and this is your small piece, and so on and so forth.
Yeah, but on this note, I resonate with you, because I think having to move into a managerial role, this was also something that I fight to get into. I fight to be in that position internally, because we used to be at a position where we take on the work and we just do. And now that you're managers, you're supposed to kind of delegate, empower your staff,
It feels like a complete
Correct.
utter difference.
And alike with you, I used to feel very paiseh that I have to ask my staff,
Yes.
say, sorry, can I get your help to do this? And then there you are, when you turn the other way around, your boss tells you shouldn't be asking them for help. You should tell them that it's part of their work.
Oh, right.
It's that kind whereby once again you're in the middle, right? Between the two.
Yes.
And you are like in that conflicting position, like, so I don't do it myself, and I'm gonna get my team to do it. That even for us, it's a baby step. To kind of learn how to kind of delegate, cut that pie out.
Oh, that was. But once that mindset switch, you'd be like, oh.
Yes.
But so it was, that you're fighting you, and then after that brainwashing, you brainwash yourself, that mindset, you're like,
Yeah.
actually,
It's not too difficult.
not at all.
Yeah.
And when they thrive,
Yes.
when the team thrives, well, you feel like a mama's pride. Oh,
Yes. That's like my proud baby
done.
over there kind of thing, right?
Yes. So when you see them being able to do that,
Yeah, like
and
a pat on the shoulder
like,
yourself.
well done, really well
Yeah,
done.
I know.
And
Go
if
ahead.
you think back to when you were in their shoes and you were given that piece of the pie
Yes.
and allowed to run with it, that's how you grew
That's
and you
right.
developed.
Yeah.
So in
Yes.
its actual way, it's like a gift. Giving.
So if my team
yeah.
says giving you
Yeah.
work is a gift.
But
Take
you're
it as
really,
a
I
gift.
think, I think you really, mentioned some really important points to moving up from being a team member to now being part of the leadership and a manager is learning how to prioritize, because you cannot deal with everything at the same time. You need to be able to prioritize, because your team is going to take that direction from you. Whatever you say is important, that's what your team is going to take as important. And to be able to delegate, right? Which I think everyone who's listening is nodding, because anyone who's had to learn how to delegate knows how hard it is to trust someone else. It's you can depend on yourself, but when you have to trust someone else, it's a different ballgame altogether. But the fruits of that, being able to give that over and then watch your staff grow and develop into the team of Avengers, that you're dreaming of, I think that really pays off. Yeah. Thank you so much for sharing that. This has been an amazing conversation, and there's so much rich information that we're going to have a part two. So do look out for that.